Hi, my name is Katlin and this is Quincie. We're going to teach you how to stand up from a walker today. Our patient is a 67-year-old female. She has a hip fracture on her left, so she's going to be wanting to walk wayfaring his top hand. We chose a walker because it's going to have more stability because she's a little bit older, and it's just going to be easier for her to move around and take off the weight off that left leg. So I'm going to first show you how to put the gait belt on and stand her up. We want to lock the wheels and make sure we swing these legs out of the way. So when I put the gait belt down, I want to make sure I go through the teeth side first. I'm going to have Michelle lean forward just a little bit here. Lift your arms up. Go through the teeth. I want it to be snug, but I don't want it to be too tight. I want her to be able to breathe, but I want it to catch her if she's falling. So I'm going to slide it through here. I'm going to slide it through the second buckle here. And there's a lot of extra belt, so I'm going to just tuck it underneath, get it out of our way. Now the wheelchair is all ready for her to stand up. I'm going to put the walker right in front of her. And when I teach my patient how to stand up, I want them to push off the wheelchair. I don't want them to push off with the walker because it might roll away and get in front of them. So what I'm going to tell you, Michelle, I'm going to have you push up or scoot forward just a little bit on your chair. Now push up with your hands and try to keep the weight off of your left leg while you're pushing up, okay? Now I'm going to support her right here. I'm going to try to use good body mechanics, that way I don't hurt myself or her. And go ahead and stand up. There you are, and grab onto the walker. Now this walker actually fits her pretty well. What you want to do is make sure that the arms bend at like about a 20 to 30 degree angle. Or a really quick way is, just go ahead and straighten your arm. Have the walker handle just reach her wrist pretty straight there. And go ahead and put your hand back up. Now I'm going to teach her how to walk with a 3-point gait. What you want to do, this is technically a modified 3-point gait. What I'm going to have her do is put the walker first, then you want to go with the affected leg, and then the non-affected leg. Okay? When you do that, I would guard the patient with my hand on her gait belt, and my front hand right in front of her shoulder if I thought maybe it was unsafe. Go ahead. Alright, after a couple of yards, we're going to have her turn around and try to go back to the wheelchair. You want to do kind of short steps so she's not pivoting too much on one knee. Now when she gets to the wheelchair, I want her to back all the way up so that her knees kind of touch the back of that chair, so she can feel it. And I'm going to have her reach back, just like when we stood up. I want to reach back and grab the wheelchair with both hands first, and then sit down. Control yourself so she doesn't flop. Another way, this is how you would adjust the walker, is you just want to flip it upside down and use these little buttons here to push it up or down. This one's a little sticky. But anyway, you would just like push the button in and you can slide the walker handles up or down. Like that. Make it shorter or taller. You can also fold it in by pushing the press buttons. You can just fold it in like that. When the patient gets the walker out to use it, you want to make sure when they pull it out that it all the way locks on the sides. That way it doesn't fold in while they're standing. Alright, and thank you very much.